wanted to also add that today I'm wearing a shirt from One Broken Biker. Try not to put a crotch shot in there. Nobody wants to see that, not even me. So this is an organization that I relatively recently learned about, and they're an organization that has groups in Alberta and BC and Ontario, and they're looking to expand into Manitoba. I had a good look at them online, and I spoke to a person involved with that group from Alberta. And for me, the important things was that it's a volunteer-driven, nonprofit organization, and although they have a symbol on their shirt, what I like is that they don't in any way emulate OMG or Outlaw Motorcycle groups with respect to the three-piece patch, top and bottom rocker, and your colors in the middle. Because there are, firefighter and law enforcement groups that do that, and I don't like that because we shouldn't emulate those fucking people, criminals, in any way, shape, or form. But there are groups out there that do that, which aren't part of the 1%, and that's fine. But that's something I would never want to be a part of, because I don't think we should try to fucking act like those guys in any way or look like them in any way. That being said, One Broken Biker is a group that helps with legal support for motorcyclists who are involved in accidents, and financial support, and they have poker runs and all kinds of events that they do to raise funds for that kind of work. And if I can in any way be helpful, by following them online and promoting them, I'm more than happy to do that, because this is something that happens on a regular basis, and people who have questions about procedures, legally and insurance-wise and all that kind of stuff, need all the help they can get, and some people don't know where to go. So check them out online, One Broken Biker, and learn for yourself, and that may always be a good reference that you can make to someone who's been in a similar situation as I have. On to the video. Morning, everybody. It's been a few weeks since I did a video on my story, and the last time that I did, I was talking about sort of the transition from one ward to another, and I think I'd probably been in 6 wards in total, counting the ICU. And again, that kind of what ward I went to and the order in which I went to them from, if that's good English, really depended on my healing and what my care needs were at that time with respect to treatment and my injuries and all that kind of crap. And we were learning a lot about how the medical system works, at least here in Manitoba. And most pertinent to us was an agency known as the WRHA, or the Winnipeg Regional Health Authority. And just like any other agency or authority, it's a bureaucracy fraught with inefficiency, and a healthcare system that, until you experience it firsthand, really runs on budget first. It always fucking comes down to money. It never should, but that's just the reality of things. And that affects patient care directly. So that can be something, well, it is something that's extremely frustrating. It was for us. Us, because this didn't just happen to me. This happened to my entire family. And all the people who were really directly involved in caregiving. Because the hospital and its staff can only do so much. So, you know, my caregivers were my daughter, my wife, my daughter's boyfriend, my brother. Those were really the main ones. But everyone that came by and visited me, whether they were really close personal friends, guys and gals I knew from work, supervisors, brass, who often, you know, get a bad rap, and sometimes it's for a good reason. But the ones that came to visit me are the ones that really cared, and ones that I could talk to despite our disparity in rank. They were people, most of them were people that I had either worked with or worked for. And, you know, I always felt that I could be myself, whether or not it got me in shit or chewed out or whatever. I really didn't care. But anyway, so getting back to learning how to navigate the WRHA, one of the biggest things is patient advocacy. And I can tell you right now with absolute certainty that if I didn't have people advocating for my health and well-being, my treatment, I'd have been fucking lost. If I'd have been there on my own, which is a real sad thing because I saw a lot of people who were alone, I would not have received the treatment that I needed or the treatment that I required. I think back to when I was in the rehab ward, or RR5. That's really where it's my treatment and the advocacy stood out to me the most, because that was like the final step before I was going home. You know, really getting geared up to be ready to be released or discharged. What we found is that all too often meetings with the doctors are infrequent. Each doctor will have a ward doctor, and you might have the same one for a week. And then the next week you might have a different one. And so they're never there for very long. And each one kind of does things differently, does things their own way. And that affects you, the patient. If it affected me. And it also affects our family members. And I mean, if you didn't ask, or if someone wasn't there to ensure, like if my wife and my daughter weren't there to ensure that I got to see the doctor, then the whole week could go by without them seeing the patients that they're in charge of. Really the highest one in that floor. The ones who have the most decision making were the ones who you saw most infrequently. And you know, each one kind of has a plan. They look at your medical chart, and they decide what it is you need and how to implement it. And they don't always listen to the patient. More often than not, they don't, unfortunately. And so if you're in a reduced state in any way, as I was, because of injuries, including ones to my head, this one. I had others too, but if you have cognitive issues because of an injury, if you're on heavy opioid medications, which affect how the old brain works, you know, a doctor might have 5 minutes to come in to explain you something or explain your options. Usually, for me, it was often I was so fucking tired and I was just so focused, consciously and subconsciously, on healing and getting through each day with the least amount of fucking pain. You're inclined to just, yeah, okay, doc, whatever, without really understanding what it is they're saying and how that's going to impact you down the road. And if I didn't have my wife and daughter and other family members there to point out what other doctors said, or to point out how I was feeling, to speak on my behalf, I'd have been fucked. And there's no way I would have healed as quickly as I did, or as well as I did, because it took my family members fighting for me, fighting to ensure that I got what I needed. And I am forever grateful, thankful for that. Because I wouldn't be, I don't think I'd be, honestly, I don't think I'd be as far ahead as I am now. So thank God for that. And I saw so many people in RR5, the rehab ward, who had nobody. People who were way worse off than I was. People with spinal cord injuries, limb loss, paralysis. You know, just the heavy dose of medication that they're on, and the fact that you're always just so fucking tired. Real debilitating exhaustion. And when that becomes the norm, it was for me, every fucking day, except for maybe it's the weekend when I didn't have physio for an hour every day. You just, when you get back to your room and you're getting bed, you're just fucking, I was just shut the fuck down. And every time, and there were, most of the time I was in the hospital, I was in bed for 22 hours a day, which fucking sucks, by the way. You literally count the pinholes in the fucking ceiling tiles, which I did, although I should have recorded it. But it's just, so sorry for the sidetrack there, but you're unable to make a qualified and really informed decision. In law enforcement, you know, as cops, well, one of the hot topics when it comes to doing your job and the rules and legality is informed consent. What truly informed consent, and basically what that boils down to is the person or the subject really being aware of what's going to happen or what the consequences are of the choice that they make when they're given options. And so that you don't always get it when you're tired. And I wish it on no one to ever be in the position that I was, or to be in hospital as long as I was. But friends and family, if you're ever have someone that you love, someone that you care about in hospital for a long time, sorry, a piece of pancake left over. Be involved in their care, because they need you. They won't even know it. When they're medicated, when they're hurt, when they're healing, when they're just trying to rest, they need you there. That's such a huge, huge thing. And some healthcare practitioners hate it. Doctors hate, most of them, fucking hate being questioned. But there's so much to the amount of medication, what medication is required, and all that kind of stuff. But, you know, those questions gotta be asked. Why am I taking this if I don't have these symptoms anymore? Why is that medication the best one? You know, why are you taking a medication away if I still have these symptoms, you know, and you gotta fucking have somebody there to push for you, because the patient's biggest need is to heal, and you should be able to focus on just that. I had briefly mentioned the money factor, and you know, to me, what I associate that with is how often you see the doctor, how many patients there are on the ward. The ratio of patients per nurses is just fucking mind-boggling. There is no way that one nurse, the fucking grunts of the healthcare system, whether it's in the ward or in the ER, I mean, nurses to me have always just shared such a similarity with GP cops. You do the most work, your hands are the dirtiest. You know, a nurse should not have so many patients, and some of them would have, you know, 7 to 10 patients per nurse, and you have to look after your charting, which is, you know, your report writing and stuff. You have to look after medication and all the healthcare tasks required that are physical and intimate. And then on top of that, that patient needs you to be a human being, because the things that you're doing involve, you know, such close personal care. A patient needs to feel like a human being, not just a fucking statistic or a number on a ward. And nurses are over fucking worked, and they're burnt out. And you know, that's how money comes into play, is you need more of them. You need nurses to have a maximum amount of patients that they can look after, and it has to be regulated, and it's not well enough. Our healthcare system's fucked, and the man in charge who campaigned on that, I'm not going to get too political, you know, nothing's improved, nothing's changed in that regard, and the people who work those difficult jobs, unit aides and nurses and all that kind of stuff, they need a system within which they can operate more efficiently and humanely, because the one they have now isn't that. So yeah, I think, you know, touching on advocacy as I did, you know, I think on top of everything I've said so far, doctors need to listen more to patients and not argue and not have that attitude that they're inflexible and that what they know is best. They need to listen to the family members who notice things that the patient isn't conscious of themselves. Tons of fucking things that I wasn't conscious of, and I needed another set of eyes, someone who could speak for me. Not that I was incapable. I mean, for a little while I couldn't talk, and I was barely fucking awake and all that bullshit. But you need somebody there, and the WRHA is not designed well to support that. So, you know, if you're listening, Mr. Head of the Province, do something about that. Make the system run better. Enable those who work fucking hard to do their job more efficiently. And don't expect them to do more with less. That's one of the worst fucking things, whether it's policing or healthcare, you know, the constant, or firefighting. That's another big fucking one that our COW, that's an acronym, has an issue with right now. Those bastards have a pretty goddamn important job. They're one of the most important frontline first responders and service providers. And, you know, the city's attitude, again, is all because of fucking money. Those guys you can't do more with less, without severe consequences. WRHA is that. COW has that, and it's unfortunate, but Will things ever change? Believe it when I see it. So yeah, and then so figuring out the particularities of the WRHA itself, was an ongoing challenge, and I'm sure that I could talk about it for another hour. But decisions should never be made based on what their category qualifies for in terms of support, financial or otherwise, or care. It should be based purely on what they physically and mentally need. End of fucking story. But now that we're getting close to the end, another bureaucracy, the worst or more evil of the two that I had to deal with, that my family and I had to deal with, was MPIC. And they were involved in my care while I was still in hospital, almost at the beginning. And there's another fucking piece of shit, government purse, fucked up, ignorant bunch of cocksuckers that I've ever had to deal with. And they have treated and continue to treat my family absolutely horribly. I think about one of the most horrible things, like kind of going back to the beginning of where the two bureaucracies met, the WRHA and MPIC, was when I started dealing with an OT, or occupational therapist. And I had some fucking doozies, both in hospital and afterwards. And it's almost like the two had an agenda. Occupational therapists are supposed to advocate for a patient's care, not act on behalf of the insurance corporation that funds your support, whether it be income replacement, compensation, medical needs. But I can tell you that some of my first occupational therapists, without even listening to what my needs were, or listening to what my wife told them, they would say things like, "Oh well, MPI is not going to pay for that because you don't qualify for it." How fucked up is that? Why should someone involved in my patient care, or in anybody's patient care, tell you what you do or don't qualify for based on what the insurance agency will pay for? First of all, well, there's no first of all. There should be no fucking way that that's involved in the decision making. One agency should not direct the other. And that happened in my case. And we had to fucking fight. No occupational therapist should say to me that or anyone, no one should ever have to go through this, that you don't qualify for something because that agency won't pay for it. The OT's only job should be based on so-and-so's injuries. This is what their medical needs are, and therefore I'm going to fight for that piece of equipment. I'm not talking about, oh, the patient wants this or the patient wants that. I'm talking about what a treating, hands-on physician, surgeon, doctor has said the patient requires. The OT should only say, acting on the patient's behalf, to whatever insurance agency, whether it's WCB or MPIC, this is what the patient requires. They should in no way say, well, you don't qualify for that, because they won't pay for it. I could go on for several more minutes about how fucked that is, but I won't, because we're getting to that 20-minute mark. In fact, we're a little bit over it. And the next time I do a video, I will definitely get more into the MPIC issue, which continues to be an issue today. as always, there's people in every organization that are good and bad. Things started horribly for us. We have a better person now, but that organization is still fucked. Fucked to the point that, for everyone who knows my story, knows that we had to retain legal counsel to help us in the fight, and thank God we got the best. You know who you are. But that shouldn't be the case. And I could do about 5 episodes alone on what NPIC is like. But we'll get to that in turn. Until then, take good care of yourselves. Take good care of your family members. Work fucking hard when you're at work. Work for what you want to get. Expect nothing. Enjoy your shift. Enjoy your days off more. And if you ever need to talk to anybody, talk to someone in the behavioral health unit, talk to a peer support person, or if it's worse than that and imminent, you know the phone numbers you need to dial. But if you just need to talk to someone and you don't want to do it through work, there's lots of other resources out there. And I put the important number up at the end of the video. And every single one of you out there doing this fucking job is important. So look after yourselves. Love you guys. Take care, and we'll talk to you soon.